Today I want to show you how to use a scale to respectfully assess your client's lethality and also direct them towards the present moment and the creation of hope. So most people that are going to watch this, you may be familiar with scaling. Usually we're scaling symptoms, anxiety, depression, medical professionals scale pain all of the time. And so usually when we're using a scale, it's a pathological approach. What we're going to use today is what we call a hope scale. And so, simply put, how you use it is you ask the client on a scale of 1 to 10, 10 being, complete hope that anything is possible, being excited about your future because the best is yet to come. That's defined as the 10. And on the other end of the scale is complete despair and hopelessness where you want to kill yourself. Heck, you even have a plan to kill yourself, and you're sure to do it. That's a 0. And remember, as we're defining the 0, we're building in our lethality criteria. So you can cook whatever lethality criteria you want into the scale that you want to hit. So again, when we're doing assessments, these kind of can be tricky questions to ask clients in a respectful way. So 10 is complete hope. 0 is complete despair and a plan to kill myself or to hurt somebody or whatnot. Where do you think you are today? Client says, I'm at a 5. Okay. Next question you're going to want to ask is, okay, if you're at a 5, why aren't you lower? Because we want to have the client be aware of what it is that they're doing that's maintaining their current level of hope. So we want to ask the client, well, why not lower? Well, I'm in a pretty good relationship. My mother's supportive. I still have my job. So I feel like things could still turn around, and I'm no longer at the hospital where I was at after I cut myself. Okay. Great. So that tells us where they are now. So we ordered the client to the present moment, and we know that they're not lethal right now today. The other thing we can ask the client, we can use the scale and say, well, have you ever been lower than a 5? And maybe the client has been. Maybe they've been much lower. The client says they have, and you ask them, okay, how did you turn it around? You just ask them, if you've been lower, well, how did you turn it around? Well, I went to the hospital. I started a medication regimen. I went to an outpatient program or a day treatment program or whatnot. And then we start to get an assessment of what led up to the hospitalization or the prior deterioration, as well as the things that work to increase the client's functioning and improve their hope. Lastly, what we can do is, since the client has been orientated towards the present moment, they said that they're at a 5, ask the client and invite them to imagine what would it be like, what would you feel like if you were up just one more point. So what would a 6 feel like in terms of hope? Well, I'd be putting out more job applications. I'd probably be calling my family more often. And so we want to then ask the client what are the things that they can do to increase that hope. But it'll become much more specific and behavioral. Because when we think about hope, we think about it as a vague concept. Scales make vague concepts behavioral and measurable, which makes the client able to increase that hope by setting up new behaviors. So asking the client, well, what can you do to get yourself to a 6? Well, I could start calling my family more often. I could go online and look at job applications. Okay. And again, what difference will that make to you? Well, I'll feel more optimistic, and I'll feel like I'm not being so lazy, and I think it'll work. Okay. So we've moved from a place of not just the concept of hope, but the behaviors that will increase and improve the client's experience of hope and direct them towards future change. And the more that we order the client towards future change, the less likely that the client's mind will deteriorate and go back to a despairing presentation. We want to foster hope. So I hope you find this helpful. Thanks. Take care.